Children between the ages of 12 and 17 can now be vaccinated against the coronavirus. But many parents who even they themselves have received the vaccine still have concerns about giving their teen or preteen the shot. One of the biggest questions many parents have is if children were considered low risk for catching the coronavirus, why should they need to get the COVID-19 vaccine?
Clearly, we follow the guidance from the American Academy of Pediatrics. And as soon as they put out their policy statement strongly encouraging children and adolescents 12 and up to get vaccines, and we were all over it. We were waiting for that moment in time to protect our most vulnerable population. What the evidence and the data show is that the vaccine is safe and very effective amongst our children and young adults 12 and up. We want to make sure they're protected because the long-term consequences of COVID infection are significant. And we are seeing lots of 6 months long events following infection. Things like fatigue, headaches, memory changes, cognitive changes. These are very significant for anyone, especially young minds that are learning.
And right now, pediatricians are urging parents to get their child vaccinated as soon as possible because of a new COVID-19 strain.
The Delta variant is concerning because we have found that it is much more infective, contagious than the regular COVID variant that we've been seeing. And not only is it more contagious, but it seems to be more serious in terms of the impact of disease. With that said, the populations that are vaccinated do not seem to be infected with the Delta variant. The majority of the infections are coming in the unvaccinated population. So with that data, the argument is strong that we need to protect our children because they will be the reservoirs for the Delta variant, and they will be the population most infected by the Delta variant. And we are seeing that already. The spikes in the pediatric population with this new variant far outweigh the spikes in the adult vaccinated population.
So if parents do decide to have their child vaccinated, there are a few key things to note.
The Pfizer is the only vaccine that is approved for children 12 and up. Even though disease appears to be mild, we know that the virus crosses into the blood-brain barrier pretty easily. That results in loss of taste and smell. So there is no case where mild infection is not significant infection. It may not appear that way on the outside. We don't know what the long-term consequences will be of having COVID in different organs in your body. But I would much prefer to prevent infection in my brain or in any of my child's organs versus roll the dice and assume that they will be better off being infected.
And regarding the risks of getting the vaccine, health officials say there have not been many cases of severe reactions or symptoms in children.
I think that parents are confused about the side effects of the vaccine. The side effects are very mild. You can have soreness at the site of vaccination. You can have fatigue. You can have some chills and fever, headache, myalgias, joint pains, but that's pretty much the extent of the side effects. Very rarely there have been a few cases of myocarditis, which is inflammation of the muscle of the heart. And that has caused some parents to hesitate. I would urge them to reconsider because the incidence of myocarditis with COVID infection is exponentially greater than with the vaccine. So if you compare risk and benefits, the benefits of vaccination far outweigh any risk.
But many parents are worried about getting their child vaccinated against COVID-19 while also preparing for back to school with other required immunizations.
It is absolutely safe to co-administer the COVID vaccine with any other vaccine on the regular schedule. The data and the clinical trials are very clear. There is no difference in side effects administering the COVID vaccine alone or co-administering it with other vaccines that are due at that time.
We have more resources on our website, toplinemd.com, for patients and parents to learn more about the COVID-19 vaccines. Plus, if you don't have a pediatrician for your child, all of the affiliated doctors' information can also be found on that page.